Thank you. Good morning, everyone. I'm Dat. I'm PhD student in Laboratory of Electrochemistry and Biosciences in Université de Sherbrooke, Canada. So maybe you already heard about in the presentation of Philip and also Miguel. So there we're talking about the EAB sensor, which is electrochemical after-baseball sensors, and also how we translate Aptamer identify from SELEX to surface. So my talks focus mainly on how we can use this sensing platform for a specific application. So which is monitoring an anesthetic in conjunction with its antidote in real time. So the molecule we are interested in measuring is rocuronium, which is mainly used in general anesthesia. So here's the structure of this molecule. So which is an amino steroids. So and uh, we use this molecule for some purpose like in general anesthesia and for mechanical ventilation or also tracheal intubation. And the pharmacokinetic of this medicine is so fast, like you see on the slide, the onset time is around 1 minute and the duration time is around half an hour. So meaning we can't use chromatography to monitor this molecule because under chromatography is sensitive, but it takes a lot of time to prepare the samples and also measure the concentration of the molecules. So for this reason, we think we can use this sensing platform EAB to measure the concentration of this molecule. And another reason why we are interested in measuring this medicine, because one of the major side effects is the residual blocking effect after operations, meaning the patients still remain unconscious after surgery. So for prevent this side effect, we typically use a molecule called sugammadex, which is the antidote of rocuronium. So the antidotes will encapsulate the rocuronium structure, and in reality, to determine when and how much the antidote we should inject to patients is very challenging. So typically, the anesthesiologist will measure the muscular response of patients using this machine, and based on the value, they will decide how much the antidote they should inject to patients. So to solve this problem, we propose using the EAB sensor to first directly measure rocuronium concentration in real time. And after, based on the measured concentration, we can determine the dose of the antidote. So this sensing platform is so advantageous for this specific application because first we can miniaturize the sensor and we can place on the catheter. Since we use electrochemistry to transduce the binding signal into measurable breakdown, so that means we can get the sensor response very fast in second resolution. So you can see on this figure. So this is the the pharmacokinetic tracking of the antibiotic vancomycin. So we can use the sensor to measure in real time the drug concentrations, and that provide us the response extremely fast. So here, I just want to show you a little bit about the sensor component. So we test the aptamer on the ground surface, and another extremity of aptamer we modify chemically with the redox refractor. In our case, we typically use methylene blue, which allow a strong transfer. So we use a technique called electrochemical impedance spectroscopy to interrogate the sensors. So in the absence of target, the redox position far away from the surface, so the electron transfer is lower. So you see the peak is shifting on the lower frequency. And in the presence of target, Aptamer undergoes structure switching to capture the target, and that makes the redox closer to the surface, and the electron transfer rate is faster. So the peak is shifting at the right to higher frequency. So as mentioned in the presentation of Philip, so one of the challenge for this sensing platform is how we translate the aptamer identified from SELEX to suffix. So for this, we also perform aptamer truncation to shorten aptamer stem. And doing this, you also see on the right spectrum. So at the free state of aptamer is already unstructured, destabilized, and in the absence of target, the resonance going up, meaning aptamer form in its structure in upon target recognitions. So we also test the aptamer affinity towards rocunium and also some molecule potentially present in the samples. So the aptamer shows good affinity for the molecule of interest and also cross react with other molecule, but at very high concentration, about than their maximum concentration around 2 micromolar. And since we want to use this sensor to measure the concentration of target and then determine the antidote dose. So we want to just make sure the aptamer doesn't bind to the antidote, and doing titration, we can confirm the aptamer doesn't bind to the antidote, which is sugammadex. So the first question we already answered. So we can use the sensor to measure the rocuronium concentrations. And the second question is how we can determine the antidote dose based on the measure rocuronium concentrations. So for this, if we are looking at the ITC results, so the KD between aptamer and target is around 5 micromolar, and the KD between the antidote and target is around 60 nanomolar. So meaning in the presence of the antidote should compete with the ligand from the binding site of aptamer. So that is true. So we perform the titration of the complex between aptamer and target with increasing antidote concentrations. And we observe that the ratio around 1.5 antidote and target enable to encapsulate totally the target from the binding site. And the technique we use is very nice because it allows us to track what happens in the electrochemical cell. So if you see on this graph, in the absence of target, which is in PPS, so the peak is at lower frequency, and in the presence of rocunium, the peak is shifting on the higher frequency, meaning the electron transfer rate is faster. And when we injected the antidote encapsulates the target from the binding site, and in that case, the peak is shifting back and at lower frequency, meaning the antidotes already encapsulated on the target from the binding site. So we also demonstrated that the sensor works very well in horn blood, and for this, first we measure we just challenge the sensor in blood and measure the response around 2 minutes, and then we injected increasing target concentration, and we see the response going up. And then we injected the antidote, and we see the response going back to the current baseline. So which means we can use the sensor to measure first the rocuronium concentration and also determine the antidote dose. So I did another control where I just dilute the solution with PBS without the antidote, and we observe the minimal changes in response. And our ultimate goal is to make this system automatic. So we use the computer to control the infusion rate of the medicine, and the sensor will be implemented in patient. And for this project, actually is an ongoing one. So we use the potential state wirelessly to interrogate the sensors. So since we have the response of the rocuronium concentration in blood, and based on the major response, we can determine which how much the antidote we should inject to patient. And since this is a feedback control system, so based on the sensor response, we can inform which and how much antidote we should inject to patients. So nothing is impossible without any support from my supervisor and any and without our wonderful collaborators. I want to acknowledge to my supervisor and also our wonderful collaborators from Yale, McGill, and Montreal University, and also the funding agencies. And thank you so much for your attention. And also happy to answer your question.